Hello, my name is Sarah Wright, and I'm the School of Medicine librarian and the head of clinical and statewide engagement at the Health Sciences Library. We're back for week 2 of our HSL orientation videos, and our video today is on PubMed searching for medical students. Our outline for today's 20-minute session is as follows. What is PubMed and why should you learn how to search it? An overview of the PubMed database, looking at Boolean searching and PICO questions, and then looking at some search examples and practicing our search strategies. What is PubMed? So PubMed is a free search engine or a platform that accesses Medline, which is the database, which has over 30 million citations from the biomedical literature back in the early 1900s. Articles are indexed and placed into PubMed every single day. As we mentioned last week, make sure that you're accessing PubMed through the HSL's website so that you can get access to the full text articles. If you go on your browser to pubmed.gov, PubMed does not know that you're coming in through UNC to get the full text articles because it won't know that. So again, using the library's website is the only way to get to the full text articles. Why should you learn to search in PubMed? It will help you answer some small group learning questions that you have throughout the year. If you become familiar with searching for clinical information in patient care in the future, that will be very helpful for you. You want to be able to quickly find evidence that's useful for patient care. You want to work on mastering your PubMed and database searching skills during the next 2 years so that when your clerkships start, you feel comfortable using the database and searching in PubMed. Remember that it's a skill that takes time and takes practice. Just like sport or ice skating, and then the more and more you search, the better you'll get at it. And finally, using PubMed allows you to narrow searches and using filters to change your results, whereas Google Scholar does not allow you to be specific with your search terms, and many of the results will be irrelevant because Google Scholar is searching the full text of the article and PubMed is only searching the title and the abstract. So here's an example of the search screen and the search box. So I went to HSL's site, and in the box I typed schizophrenia and memantine and hit search, and it brings me to this page. And everything on here is what you would get for any search in PubMed. Let's take a look at what some of these features are. So first of all, your title, your search words are here up in the title searching box. You have displays, either most recent or best match. Best match is PubMed's algorithm method of saying that I think that these are the most important articles you're going to want to look at. But sometimes they can also not be as relevant and recent of articles if it's from 2013, say, if that's the best match from the system. You can tell how many articles you want to look at per page, and then also show your snippets, which is your brief 1 to 2 sentence of the start of the abstract. So those are the display options. Next, we have a sliding toggle for publication date. So you could slide this over to wherever, let's say you're only looking for articles from 1990 to the present, you can slide that to 1990, and then your results would only be those with the publication date of 1990 to the present. You have many different methods of getting the results from PubMed somewhere else. You can either save them as a text file, you can email those citations and abstracts to either yourself or a colleague or an attending as you start your clerkships, but it's a way of showing that group of articles that you chose. And then finally, you can send your results to a bibliographic management system such as EndNote or SciWheel, to then use that to pull PDFs of full text articles and also use that to write and cite in Word. And then finally, publication types, article types, you can narrow your results by looking only at randomized control trials or systematic reviews or meta-analyses, whichever one you want to use. And then down below that, there are a few additional filters. Language is one of them, and then also age, which is a great one if you're looking for pediatric population. You can do 0 to 18, you can do newborn, you can do aged, 80 and over, and again, it just manipulates your data a little bit more for you. And then finally, each record gives you the title of the article, and if you clicked on it, then you would go to the full text, or I'm sorry, the Find at UNC button, which could potentially give you full text. And then it also has the citations, so that's the authors, the abbreviation of the journal, year, volume, issue, and page numbers. A few PubMed basic search tips. So your search strategy is only as good as what you put into it. So think about synonyms and other terms. Let's say you were just searching for a heart attack. If you add myocardial infarction or MI, you're going to get more results because again, we're using the OR terms, so PubMed can find any of those terms in a title and abstract of an article. It will pull those for you. So unlike OR, where any of these can be available, and means you're combining words from different concepts of your search. So again, you can have either allergy or anaphylaxis, and then and peanut. So peanut needs to be in every article, allergy or anaphylaxis, either one can be. So here's one down here, diet therapy, which is an and, so we have to have diet therapy in every article, and then you can either have bulimia or anorexia, and then you're looking for that middle part gray area, which is what your results would be. Another tip for PubMed would be using variant word endings. As you can see, the asterisk is the Shift 8 key on your computer, and it's called a wildcard, so it will pick up any ending after that last letter of the word. So let's say you're looking for prevention. If you did prevent asterisk, PubMed would find prevent, preventing, preventions, prevention, and then any other terms that would be with other endings after the prevent. Anaphil with the truncation would do the same thing. We'll search for anaphylactic, like anaphylactic shock, or if someone is in anaphylaxis, it would find either one. So you want to be a little careful using that because sometimes it's going to give you more results than you're looking for because it's finding that term somewhere else. A good example would be if you're looking for the word walk, you're trying to get a patient up after an operation, after surgery, and they need to walk around their room. If you did walk truncation, that would give you walk, walked, walking, walks, but it would also get you walker, and that might not be what you're looking for. So again, look carefully at your truncation to make sure it's giving you the relevant articles. So when I look at an image of how I put my search together, this is how I work through it. I look at each of my terms as being a bucket, and each bucket has a handle on it, which serves as your parentheses around all of your OR terms / synonyms. So in the bucket for diabetes, I would have my diabetes, I would have a synonym for diabetes, maybe diabetic or diabetics, and then also adding mesh terms, medical subject headings, which we're going to look at and use next week in part 3 of the series. Same thing with cinnamon. Concept 2, cinnamon, a synonym for cinnamon if that's available, and then a mesh term. And again, parentheses around these terms to keep them all together. And then the same thing with diabetes. In looking at clinical questions, it's important to frame your question so that you get the results that you're looking for. One framework that you can use to create your search strategy is with PICO. There are lots of variation for PICO. There's one called Spider. There are probably 30 or 40 of these frameworks for searches. But this is the basic one that most people use, and that is looking at your patient population. What kind of patient is this? What's special about them? What disease, what condition do they have? And then a comparison. What are you looking at to do therapy, surgical procedure, any kind of intervention for that patient population? Thirdly, you have your comparison. What else could be done? or what can be done looking at the results of two separate, say, therapeutics for a disease. That would be your C, and you might not always have a comparison, but if so, it would be there. And then finally, the outcome. What are you trying to accomplish? Is it prevention, change of a condition, outlook, any of those things? Sometimes you don't have an outcome. Sometimes you might have a search topic that doesn't really fit neatly into the PICO framework at all, and that's fine. That's not an issue at all. And then finally, there are some additional ones: time frame, type of study, setting, which turns PICO into PCOT or PCOTS. And again, if that's important to you, the type of study, let's say you're only looking for randomized controlled trials, then that would need to go into the search strategy so that you use that in PubMed to filter your results. Let's take this PICO framework and ask a clinical question and come up with our search strategy. So what effect does cinnamon have on diabetic patients? Patient with diabetes is our patient population. The intervention is use of cinnamon. The comparison, not using cinnamon, or conversely, if you have a comparator drug or surgical procedure, you could add that here, and then that would kind of change your clinical question. And then finally, the outcome: better glycemic control or reduced blood sugar, but I'm not sure what I want to do with that yet. So our search strategy would be diabetes and cinnamon. And this is what the results would look like. So diabetes, 700,000 plus. Cinnamon, all articles in PubMed, there are 2663 articles on cinnamon. When we put the two together, so any article that has both diabetes and cinnamon in the title or abstract, they're 275, filtered to English, and then to 10 years, you get 203 articles. Let's try this search. 30-year-old man's diagnosed with depression. He'd prefer to try alternative medicines rather than SSRIs, which is a type of drug. The patient would like to know if he can take St. John's wort, which is a supplement, and if it would be just as effective in reducing his symptoms. So when we look at our PICO for this one's a little bit different because we have more to add. So our patient would be a patient with depression. The intervention would be the use of St. John's wort. The comparison would be the use of the SSRI, looking at the outcomes of both of them to see if the St. John's wort is truly effective and that the physician can let the patient know that that would be applicable. And then finally, the outcome would be the reduction of depressive symptoms from either drug. And again, our search strategy would be depression and St. John's wort and SSRIs. And again, I did the same thing: depression or depress, which you actually would only need that and the asterisk. I have my SSRI terms, and then I spelled them out: selective serotonin reuptake inhibitor and inhibitors. And then St. John's wort's a little funny because sometimes it's got periods, sometimes it has apostrophes, or sometimes it has none. And then combining these three searches with our or terms in each, and then our and terms, 1, 2, and 3, 138 articles. All right, so what I would like for you to do now is take 5 minutes. You're going to open a new browser tab, but don't close this one so that you don't lose the video playing. And then you want to go to the Health Sciences Library website at hsl.lib.unc.edu. And you're going to try one of these searches. I've got a countdown clock on the bottom, and you can start working on these for 5 minutes. So choose any of these three searches and give it a try in PubMed. Remember to think about your synonyms for your terms and your parentheses and your Boolean operators, the and the or. All right, we're in our last minute. Twenty seconds. When you're ready, you can go back to the video and hit play again. All right, so let's take a look at some of these. So here are the answers. And again, these are not complete search strategies, but they're a start. So can vaping cause or exacerbate asthma? So I did vaping. This one's kind of a little trickier because e-cigarette can be written out different ways, or electronic cigarette or electronic cigarettes. And then I did asthma with the truncation to do asthma, asthmatic, asthmatics, and put that search strategy together. Secondly, how effective is covalescent plasma in treating COVID-19? The library has a whole string of terms that you can use to search specifically for articles that deal with COVID. But the two main ones are, of course, COVID or coronavirus, and COVID would pick up COVID-19 also. You could put an asterisk after that just to make sure. And then convalescent plasma, and I put those words in quotations to make sure that they do stay together as a phrase. And then finally, what are the current immunotherapy options, immunotherapeutic options for patients with multiple sclerosis? So I did immunotherapy for therapy or therapies, or immunotherapeutic would pick up all that, and multiple sclerosis or MS, because sometimes that abbreviation could be made also. All right, finally, I've put together database searching skill worksheet on the School of Medicine site, go.unc.edu. It's going to change monthly. You're going to follow the instructions. You're going to submit it with some actual search strategies, and I will email you back with some search thoughts and search results that I have for you. So let's go through this last screen, and then I'm going to go share my screen for a minute or two in PubMed. So again, if you have questions, you can contact the Ask a Librarian service, which is by email. You can chat with us 10 to 4, Monday through Friday. The library is open Monday through Friday, 9 to 5 at this point. You can request a consultation with me. Here's my calendar to find time to meet with me. And then again, my email address. So let me go out and share a new screen with you, which is, okay, so here's our diabetes and cinnamon search. And as you can see, we have, let's see how many results we have. We have 275 results. Down the left-hand side, you can use the toggle to choose a year. You can choose a publication type. You can choose a publication year. Let's say you're only looking for 10 years and you're only looking for articles in English. Again, here are those additional filters: age, sex, language, species, human, or animal. And again, those are all down the left-hand side. And then on the right-hand side are all of our citations and abstracts. Let's come back up to the top. So this is sorted by most recent. So May 2020 was that the most recent article that was available. Let's find an article. So I'm going to read through the abstract to see if it really is what I'm looking for. And then here is that blue Find at UNC screen to get the full text options. And if I click on that, you can click on here to get to the journal. Sometimes it'll say, I'm sorry, we do not have this journal or this article available. And if so, you want to come down here to number 2 to request it from another library free of charge. 2 to 3 day turnaround time, and then they'll email you to let you know that it is available in your email or back in your interlibrary loan account. All right. So with that being said, we are going to stop here today. It's at the end of our 20-minute session, so you can start your next session. I look forward to working with you again next week, where we're going to talk about mesh terms and other advanced searching skills, and then look at some of the other resources we have available at HSL that you can use for your group projects and your group research that you are doing. Have a great week. Take care.